Hello, my name is John DeFrancisco, and I've been with Saratoga Schenectady Gastroenterology for the last 20 years. I was asked to speak about colon cancer screening, which I've been intimately involved with for many years. As most of you know, colon cancer is very common, but you may not be aware that it is the third most common cancer that is diagnosed, and up to 150,000 cases are diagnosed every year. And an interesting fact, which I didn't know until I did a little bit of research, is that 75% of cases really didn't present with any symptoms. So screening is very important. The next point I'd like to make is that the colon cancer screening age has recently changed. In 2021, the guidelines changed from age 50, starting these procedures, to changing to age 45. And the reason for that is that we're finding that colon cancer is presenting earlier than it had in the past. And we're not quite sure why, but we have noticed that trend, and they did lower the screening age. So anyone over 45 years old for colonoscopy. Obviously, if you're having symptoms, most of them are pretty obvious. The first being rectal bleeding. That can be for a lot of reasons, but that can be a presenting sign for colon cancer. Weight loss, change in your bowels, unexplained iron deficiency anemia. Other groups that would get screened earlier potentially are family history of colon cancer, or inflammatory bowel disease, or hereditary syndromes, which is beyond the scope of me talking about right now. So you have different choices as far as colon cancer screening. I'll go through quickly a few that aren't really being used all that much. Sigmoidoscopy is a short procedure that just looks at the first third of the colon. That's generally not used at all for colon cancer screening. The second is virtual colonoscopy. There was some enthusiasm to doing a CT scan and looking at the colon that way, but that never came to fruition. Capsule endoscopy may be in the future, but is not ready for prime time. The first screening test was Hemoccult testing. So they test your stool and see if the marker turned blue. That's been replaced by more sensitive stool assays. But really, it's between, in this day and age, it's between two different screening modalities. That's Cologuard or colonoscopy. Cologuard has some benefits. The first is there's no procedure associated with it. You just send your stool to the company, and they test it for two things: blood, or the shedding markers of large polyps or cancer. So the benefit is you don't have a procedure, you don't have the risk of the procedure. It is sensitive to pick up cancer, 93% sensitive. But the main shortfall is that it does not pick up many of the large polyps, which ultimately can turn to colon cancer. It only picks up about 50% of large polyps. So it's a good screening test for colon cancer, but it's not the best preventative test. That brings us to colonoscopy, which I've been doing for 20 plus years. Colonoscopy is very sensitive to pick up colon cancer. It does pick up cancers at a higher rate than Cologuard. It also picks up the large polyps at a much higher rate. And lastly, and most importantly, we remove the precursor lesions before they have a chance to turn into colon cancer. So you can think of colonoscopy as an inconvenience. You have to do the prep, you have to come in for the procedure, but it's both diagnostic and preventative, whereas Cologuard is, by and large, just diagnostic but not preventative. Last thing I'll bring up, what can you do to prevent colon cancer? And some of them are lifestyle things. So some of them are obvious. One, don't smoke, don't drink heavily, don't be sedentary, so exercise. And diet, the things that have come out are don't eat a lot of processed foods and don't eat a lot of red meat. So that concludes my short talk about colon cancer screening. If you have any questions or concerns, please see the link at on the website and contact our office. Thank you very much.